LhARA, the Laser Hybrid Accelerator for radiobiological applications, will harness the unique properties of laser-driven proton and ion beams to take the study of ion beam therapy into uncharted territory. The techniques that LhARA will pioneer have the potential to enhance, perhaps even to transform, radiotherapy.
1 in 2 of us will get cancer in our lifetime. And in the UK, the incidence of cancer is actually rising. By 2040, Cancer Research UK estimate that the number of people with cancer will increase by 1/3. And really what this means is that we are facing a perfect storm. We have a rising incidence of cancer, and also we have incredibly long waiting lists. We know that in the past decade, over 500,000 people have waited too long for their life-saving cancer treatment. Radiotherapy is a personalised cancer treatment that uses beams of ionizing radiation to kill cancer cells. The aim is to destroy, shrink, or control the growth of cancerous tumours. It is a life-saving, incredibly cost-effective treatment that is needed by 1 in 2 cancer patients and is needed in 40% of cancer cures. Some patients still have limited access to advanced curative cancer treatments such as ion beam radiotherapy. And overcoming the barriers is really important, and LhARA hopes to utilise cutting-edge technology to make this type of high-precision radiotherapy more accessible, more cost-effective, and more successful for patients with cancer.
The LhARA project offers flexibility in the choice of ions. LhARA will be able to produce ions starting with protons all the way up to carbon ions, and ion beam radiotherapy is really at its beginnings, and we still don't know what are the best ions for treating radiotherapy. It may be that consider the whole of the population and different types of cancers, that actually different ions are more suited to the different cancers, and also in terms of the patient, long-term side effects may be more or less significant.
Particle therapy has always made sense clinically. There's clearly tumour types that respond more effectively when irradiated with particles than photons. The issue with particle therapy as a whole is that the way that we've architected these devices historically has relied on a source of radiation that produces the particle, and then direction of that particle into a very large rotating gantry. The problem is that those gantries, these rotating structures, traditionally have been anywhere from 100 tons for proton therapy all the way up to the largest of 600 tons. So really the problem has always been the cost associated with particle therapy. With the introduction of LEO's technology and being able to move away from these huge structures and significantly miniaturizing the infrastructure requirements for patient positioning and imaging, it then puts more of a focus on the remaining infrastructure and the remaining portion of that machine that is the accelerator. The accelerator then also has to become a lot smaller, a lot simpler, and a lot more cost effective. And that's really where the LhARA solution comes in.
The LhARA initiative has such potential to continue to harness technological advances in radiotherapy through pioneering collaborations that will continue to develop treatments that will allow patients with cancer to live longer and live better.